I will turn it over to our next speaker, Rick.
Good evening. What's that? Okay, they're going to change the tape. Okay. Good evening. My name is Rick Cagan. Pleased to be here tonight. I'm the Executive Director of NAMI, Kansas. We're the National Alliance on Mental Illness. And a lot of you know about us. We provide peer support for people living with mental illness and their family members, and we provide education programs and advocacy for them as well. And our grassroots members, some of them are here tonight, have lived through a great deal of change in the last generation. And I'm pleased to say that, especially in recent years, Disability Rights Center has been one of our key partners as a pivotal agent for change. And we're delighted to be here tonight to help celebrate the 30th anniversary of the Protection and Advocacy Service here in the state of Kansas. We've made a great deal of progress in the treatment of mental illness in my lifetime. Not too many years ago, individuals diagnosed with mental illness were relegated to a lifelong residence in a state mental hospital. As with other disability groups, persons with mental illness have earned their rights to a community-based system of care and to a life outside of the institution. Yet we still have a long way to go. We've experienced the advent of new treatments for mental illness, even though such treatments are not always effective and not always available, depending on where you live or where the treatment is being administered. Treatment works if you can get it, as we say in NAMI. This includes an array of service supports, access to appropriate medication, and peer support services necessary to ensure recovery. And the unintended consequence of untreated mental illness shows up as negative financial and social impacts on police, on educators, emergency rooms, and businesses. Cost-effective, proven treatment and services exist not only to support recovery for people with living with mental illness, but also to ensure the health of America's communities and families. More people are seeking treatment, and there is some reduction in the stigma associated with mental illness. And what this means is it puts more pressure on our treatment system that is already overburdened and underfunded. We've experienced mental health reform. We talked about deinstitutionalization. We've experienced mental health reform and deinstitutionalization in Kansas, but all the savings in dollars from mental health reform did not flow back into our community-based system of care. In fact, we have data that demonstrates that reductions in state hospital beds correspond very closely to increases in numbers of offenders in county jails and state prisons with serious mental illness. And the old adage, pay me now or pay me later, applies here quite well. The concept of institutional bias for mental illness can be viewed in terms of neglecting persons with serious mental illness. To the extent that we fail to provide adequate treatment for those with serious mental illness, including psychiatric beds when needed, we leave mental health consumers to fend for themselves on the streets, and we relegate many of these individuals to the institutional life of the criminal justice system. We aspire to have mental illness treated like any other illness in terms of the availability of care in the ways in which public and private insurance plans ration that care. And unfortunately, there is still disparity in the manner in which mental illness is treated relative to other illnesses. And our campaign for mental health parity at the state and federal levels is ongoing and is a just cause. Spoke with Representative Williams, who may still be here tonight, and he made an effort on the floor of the House of Representatives here in Topeka today, which failed to get mental health parity across in our state legislature. We still have Senate Bill 380 pending, but we, as far as I know, have not been able to get a hearing on that bill, and I would urge you to contact your members of the Kansas Senate to see if we can get a hearing on Senate Bill 380. The U.S. House of Representatives just passed a federal parity bill, and now the House and the Senate in Washington are working to reconcile their different versions of this. So looking ahead, we need to envision a 10-year plan to restore the capacity of our mental health system from hospital to home and at all points along the continuum of care. We need resources at all levels, and that's a budgetary issue that is being addressed now in our state legislature. We look forward to a future where the concept of consumer-directed care with a constant focus on recovery will become the norm in Kansas. And in this model of self-directed care, we're talking about informed mental health consumers and family members of children with serious emotional disorders who partner with coaches to assess their own needs, establish their individual plans of care, to budget funds to meet their needs, to choose how and by whom those needs will be met, and to monitor the quality of the services they receive. This model of self-directed care is based on some very profound principles of self-determination that cut across all areas of disability: the freedom to live a meaningful life in the community, having authority over the dollars needed for one's own care and support, providing support for participants' efforts to make the choices for themselves, the ability to organize those resources, and taking responsibility for managing one's own finances, choosing services, and handling the tasks of daily living, and for the use of these dollars, and for the opportunity for service recipients to participate in decisions about the service delivery system. So the value of the self-directed care lies in choosing one's own providers, having control over the funds, and taking personal responsibility and creating incentives for improving the system. This idea is new in the area of mental health, and we have a lot to learn from the efforts of other disability groups. We're excited to stand together as part of a cross-disability Big Tent coalition. I'm delighted to see many of you with your Big Tent coalition buttons on tonight, and we look forward to working with all of you to ensure a brighter future for all people with disabilities. Thank you.